for forehead fillers, I do supraorbital block and supratrochlear nerve blocks. So you can inject under the brow or over the brow, over the bone. First, the nerve comes through a foramen or comes through a notch in the upper lateral orbit, then returns comes to the surface of the forehead, frontal bone. Then it starts to get superficial and superficial, approximately in the middle length of the forehead. As the nerve advances, it becomes more superficial. Now, if you inject here, you catch the branches of the two nerves. It is a little bit more painful when you inject below the brow. If you palpate, you can palpate the notch or foramen under the eyebrows. So it's easy. So forehead is numbed. Also, you should inject local anesthesia to do lateral entrance sites. I always use cannula in the forehead. Through 18-gauge needle, I excluded this to save time. I open a hole and I enter with a 25 gauge cannula to be safe in the forehead. I always try to stay on the periosteum for safety reasons. To avoid danger, please try to stay on the periosteum when you inject in the forehead. Hyaluronic acid is a very good product because you can mold it. It's not like polycaprolactone fillers or anything. Also, you can mold calcium hydroxide fillers, but hyaluronic acid is more forgiving. You can follow the lines and inject through the lines retrogradely, but you can connect lines with finger massaging, and the hyaluronic acid is settled. You can get a flat and convex forehead. After the procedure. Usually the middle part of the forehead where procerus and corrugator muscles emerge are a little bit problematic. You have to inject it separately sometimes because the muscles presence prevent the homogeneous distribution of the filler. So with needle you can do small touch-ups with again Aqufill fillers to gain a nice and flat, convex forehead. But the surface should be smooth and flat. So again, the patient is under local anesthesia without any pain. Through a cannula, I inject Aqufill part. Why I use cannula? Because in the middle there is a parasagittal artery. Also, there are branches of supraorbital and supratrochlear nerves, arteries. I'm sorry. These branches make a network. These networks are anastomosing with ophthalmic artery branches. So, if you inject fast with high pressure, you can end up also when you are injecting with a needle, you can end up with impairment of the vision. It's dangerous, but this is not the first danger area. If you are too deep over the periosteum, it's usually safer. And finally, I'm molding the hyaluronic acid. And also, another tip is if you, for example, want to fill the middle side with a cannula, you can enter from the middle, from the top. With the cannula, you can go down and fill the middle part of the forehead. You can enter from here through a 18-gauge needle hole. You can fill in easily. You see before and after results. Before and after results. In this part, I did 0.2 ml of Aqufill retouch again. So another patient with forehead augmentation. To save time, I inserted the video of the evaluation in this patient. I again, in this time, open a hole in this patient with 18-gauge needle. The recent bleeding is central vein. It usually bleeds maybe 60% of the patient. It's called Rembrandt's vein, famous Dutch painter. Because Rembrandt has a Rembrandt's vein in his forehead, just at the corner of the brow. He has usually given detail of this vein in his dark pictures, portraits. You can easily spot. So it's called Rembrandt's vein also. So let's go to the again forehead filling with Aqufill heart filler, hyaluronic acid. The patient is under again nerve blocks for the forehead. With this nerve blocks until the vertex of the forehead is all numb, so you can do hair mesotherapy in the frontal part of hair and forehead easily. The whole part of the forehead is numb. Only for these lateral entrance sites, you have to inject some local anesthesia more. These parts are not numb with the forehead nerve blocks. Yeah. The local anesthesia I use almost always contains epinephrine in standard doses, 1 divided by 200,000. So the area is relatively avascular. In my practice, I usually inject local anesthesia like this. I inject local anesthesia in patients where I will inject before, and for 15 minutes I keep the patient waiting, drinking coffee or anything. After 15 minutes, the swelling related to the local anesthesia is gone. In all area, local anesthesia has settled. Then I start to inject. I never hurry up. Also, there is some distortion due to local anesthesia in the tissues. It causes engorgement, swelling in the tissues. After 15 minutes, 10 to 15 minutes is gone. So you can shrink the vessels with epinephrine unless there is no contraindication. Also, you can work in a very, very bloodless field. This is before and after pictures of the patient, same patient you watched a few seconds ago. Before and after. I just used 1 ml of Aqufill heart. So it is more viscous because of its high technology. It has high G prime. It has a better filling effect when you compare it with other hyaluronic acid products. Its technology is different. So let's get to the business. Please work hard before doing this, filling these glabellar static lines. You might be refraining doing this, but it is, in my practice, first thing I do in glabellar lines is neurotoxin first. In male and female patients, never filler first. And after the patient has come, approximately 70 to 80% of the patients are content with the result of the neurotoxin. They do not come. But if they insist that I feel the groove completely, if it's deep, still deep, in all patients especially, or in patients who have refrained from undergoing neurotoxin injections for years, and at the age of 50 or 60, if they have started getting botulinum toxin done. So in these patients, we cannot get rid of this. After 3 weeks after botulinum toxin injections, still she has a static glabellar line. There are several tricks. There are always vessels underneath the, according to the papers I'm talking, there are always vessels underneath the wrinkles. So you should not be too deep, you should not be too superficial. I just mark the entry and exit point. I just inject local anesthesia with epinephrine here, that's why it's white. Then I just enter with the needle. I just only feel the line. Then I mold the filler with my finger. It will be a little bit elevated in the following 1 or 2 weeks. Then it will settle. Tell the patient that do not get afraid. This is quite normal. The whole area as a column will be a little bit elevated. Then it will be over. You see before and after photo of the patient. But you should be very careful to feel this. Some of my colleagues ask, can I use cannulas? Cannulas are not that long. Maybe you can use short cannulas. But the thing is, do not go too deep, do not go too superficial. So for the marionette lines, it's a troublesome area from my point of view because there is a osteocutaneous ligament in it. You feel the patient come for the marionette lines. I again use epinephrine containing. I make it a little bit, it's a little bit speedy to save time. This is how I do, how inject. I first part that I inject. This is in the same patient. You will also watch the chin filler, Aqufill heart as a chin filler. I also did the mental block in this patient. So in this patient, for the filling the marionette lens, I used Aqufill again. It's a very nice filler. But I always tell the patient that it's a probability that maybe you are very capable of doing, but I'm not capable of doing. The patient comes again after a few months. This is not completely filled. There is again some group. I tell them about this osteocutaneous ligament to the patients before. So I tell them that you will come after 2 months. You will feel some, do some filler again. So they are content without paying anything. I fill that area again. So it's also very beneficial while you are doing fillers for the marionette area. If you approach the corner of the lower lip, you can, if you inject a little here, you can also elevate the corner of the mouth. You see, if you inject here, you can elevate the corner of the mouth, so modulus will be in the midline and corrected. Before, after, and a week later. So again, another patient with marionette lens. This patient has a thicker skin. First, I did the markings. This is acrylic M. So you are thinking about the facial artery passing underneath. Facial artery is superficial, more superficial, but it is not that superficial in this area. As it goes to the corner of the nose, it becomes more superficial, but here it's a little bit deeper. So you are on the safe side. But at the corner of the nose, you should be deeper. This is deeper, less deeper, and superficial where you inject. Facial artery has 4 variations. The least variation is close to the mouth. Usually it is approximately 10 to 50 millimeters just at the corner of the mouth. Just here, facial artery. So you see a very good result with the Aqufill soft for filling the marionette lens. So the other very difficult area, this patient has been operated for rhinoplasty 3 times. In all instances, she is confronted with complications again and again. Now she has not too much, but she has a saddle nose. She refused undergoing surgery again. When she came to me, I said there's a probability that there is an illusion that if you feel the saddle nose area, dorsum of the nose, we can make a shape that it will look shortened if you feel this area. So it looks somehow but elongated now. If you feel this area, it will look shortened. This is an illusion. But she is very content with the result. What I tell you before every nose filling, nose procedures with fillers, so you should check like this. Before I check it also, but now I'll check again, the skin quality. Now the aspiration test. If the skin is loose enough when you touch, loose enough to contain the filler, you can inject the filler inside. But if the skin has stick to the bone, you cannot inject filler and it will end up in ischemia and in necrosis. Also, you should also palpate the tip of the nose. It's very important. If the tip of the nose is, I'm a plastic surgeon, if the tip of the nose is filled with cartilage pieces, you cannot inject fillers to the tip of the nose. This is quite impossible. So be careful about when the skin is very adherent to the underlying bone and cartilage. Do not try to inject fillers. Also, touch the dorsum of the nose. If there is a bone underneath the skin, of course it is underneath the swaz, but this patient has underwent 3 surgeries. If there is no bone, when you inject, you have to first, with the tip of the needle, I almost always use the needle for nose contour enhancement, for liquid rhinoplasty. You should touch the bone. then you should be on the midline almost always. Then you should touch the bone, then start filling the underneath from bone to subcutaneous tissue. But you should be always under the smashed tissue in the nose to be on the safe side, because most of the vessels are going on the lateral side of the nose. Here there is lateral nasal artery here. You should refrain from injecting this area because skin is very adherent to the cartilage. You will end up in necrosis. From my point of view, most of my colleagues inject the columella, but I'm always afraid of injuring columella artery here, very thin artery. If you injure columella artery here, you can end up with necrosis in the nasal tip. It is very dangerous, so you should be in the midline. You should do slow injection with less pressure, with very small pressure. You should inject gently. You should avoid injection at the lateral side of the nose, because also here is a connection with the trochlear nerve. Dorsal nasal artery is here, coming horizontally, and it connects with the ophthalmic artery is here. Also, there is infratrochlear artery. It makes a network, and you can end up injecting the filler into the artery ophthalmica system. So it's very nice that after you inject with Aqufill filler, do not get afraid for the whiteness of the skin, because it's due to epinephrine. You see this patient has got a very nice shape. She will come after 2 months for a touch-up, because in those patients it's very important. Also, in patients whom I do nose fillers, I always tell them, telephone them the next day, and want them to send me photos, selfies. It's very important. When you compare with the previous one, with the after injection one, you will see it's somehow like shortened. Years ago, she's another patient, but she has not done anything, no surgery, nothing. So I again injected local anesthesia here. To facilitate injection of local anesthesia here, this part is less painful. You should just press ice packs here and do one injection. After you remove ice packs after 15 seconds, you just enter the needle and inject local anesthesia. But tip of the needle is painful. Be sure it's very painful. So you should, for example, touch here for example, maybe 15 to 30 seconds with the ice